Good morning, everybody, and hello to our online viewers. I am April Banerjee, Executive Director of People with Disabilities Foundation. Today's seminar, Integration of Adults with Autism into the Whole of Society, is PWDF's 16th 3-hour seminar related to psychiatric and/or developmentally disabled individuals. People with Disabilities Foundation was founded 16 years ago with a mission of total integration of people with mental and/or developmental impairments into the whole of society. PWDF is a Section 501c3 public charity. In addition to seminars, we produce training videos for human resource directors, vocational rehabilitation counselors, and the disabled individual. Our other program component is advocacy in 8 San Francisco Bay Area counties, primarily involving social security issues and employment. The Federal Interagency Autism Coordinating Committee stated in its 2013 strategic research plan that, quote, overall, currently there is a limited knowledge base regarding the needs of adults on the autism spectrum, end quote. This seminar will cover assessment and diagnosis of adults with ASD, available treatments, qualifying for California's Regional Center Developmental Disability Benefits as an adult, SSI, employment, and other issues as time permits, with the goal of removing program or employment barriers for individuals with autism. So now I'll turn this over to our moderator, Stephen Bruce.
Okay, we'd like to start with Dr. Paul, thank you, who will briefly talk about assessment and diagnosis of adults with on the autism spectrum. Dr. Paul.
Good morning, everyone. I'm going to go through, I think I have about 20 minutes to give you an overview of the assessment and diagnosis and the process for individuals who are later in life. And so I wanted to start off and just talk really briefly about what is autism spectrum disorder. And I think it's really important to keep in mind that autism or ASD is a diagnostic term that professionals use and the community is using more and more to describe a set of behavioral symptoms that co-occur together and cause an impairment. And this is important because there is not a single biomarker or a medical test to determine if someone has an autism spectrum disorder. So it's not like diabetes where you can check your blood glucose levels or something of that nature. And even though there are genetic screenings that can be done to look for various different mutations that may increase an individual's risk for autism or contribute to their symptomatology, we also know that a given genetic mutation does not always mean that someone will have autism, and that there's a variety of different outcomes associated with different biological genotypes. So autism is diagnosed, again, based on these behavioral symptoms that are defined in what's called the Diagnostic and Statistical Manual for Mental Disorders, and we are on the 5th edition of that, so the DSM-5. And autism is right now defined as impairments in 2 domains: social communication and interaction, and the presence of restricted and repetitive stereotype behaviors. These have to be present in the early developmental period. They must result in a clinically significant level of impairment, and they aren't accounted for by intellectual disability or another global developmental delay. So the domain of social communication, interaction, impairments are defined in 3 different subdomains, and you have to have, an individual has to have deficits in these 3 areas in order to get a diagnosis of ASD. So these are, the areas are social emotional reciprocity. So these are things like having a back and forth conversation, picking up on others' emotions, deficits in nonverbal communication. So the use of facial expressions or eye contact or gestures to support a social interaction, and deficits in developing, maintaining, and understanding social relationships. So this would be initiating friendships and being able to understand the rules around a relationship to maintain that relationship.
Excuse me, Dr. Ball, just one question. You mentioned of clinical significance. Mm-hmm. Could you define what that is? The spectrum is 3-dimensional and long, and we hear sometimes with certain individuals, like with Asperger's or other kinds of diagnoses, it has to be of clinical significance under the DSM-5, but what is your definition, or not yours, but the definition of clinical significance?
Sure, that's a great question. And I'll touch on it a little bit later on in the presentation, but to answer your question just briefly, I think that the symptoms must result in some level of impairment in the individual's ability to function in their day-to-day life. And so that could be across multiple different domains. It may be things like adaptive or daily living skills, so the individual's ability to support themselves and live independently. It may also be in other domains, such as social relationships or mental health, and so that these symptoms would interfere with different parts of one's life to an extent that it impairs their ability to function in some domain. And I think it's broadly defined. There's not one specific domain of life that you have to be impaired or struggle in for an individual to receive a clinical diagnosis. Certainly different organizations have different definitions that define where they're looking for impairments. Does that help?
So it could be mild versus severe, marked, and extreme in one domain versus in more to meet the threshold. It's a threshold definition.
Sure.
Right?
Mm-hmm.
Thank you.
Mm-hmm. And so the second domain of behaviors we're looking for when making a diagnosis is these restricted and repetitive behaviors. And you have to have behaviors or symptoms in two domains in order to receive a diagnosis. So sensory reactivity or interest. An example might be hypo or hypersensitivity to sounds or lights. Stereotyped or repetitive behavior includes repetitive use of objects, so lining up things or motor mannerisms such as hand flapping. Highly restricted fixated interests, maybe a hobby that is sort of all-encompassing and takes up a large amount of time and may result in some social impairments. And insistence on sameness, which is sort of adherence to and insistence that particular routines throughout one's daily life are adhered to. And so I think it's really important, although we define autism by these two domains, social communication challenges and the presence of restricted and repetitive behaviors, that clearly each individual person with autism is not defined by those specific domains of challenges. And we also are taking into account their language abilities, their cognitive functioning, and emotion is sort of a broad way of referring both to their own responses to the environment as well as their mental health. And so these domains are sort of important to be thinking about the sort of, and all come together to really form the heterogeneity and the diversity that we see in individuals with autism. So ranging from someone who is severely cognitively impaired to someone who has a superior intellect, and individuals who are completely nonverbal and do not use spoken language, to individuals who have very high verbal IQs and strengths in their ability to express their knowledge. And so it's important, finally, to also remember that autism is a developmental disorder. And so the core features, so those social communicative challenges, those repetitive behaviors, they vary depending on how old someone is and how, at what developmental level they are functioning. And we have evidence from research that over time, individuals continue to develop skills. So social communication skills that are impaired at very young ages, so toddlers and preschoolers, those may be achieved at later points in life. It doesn't mean that there are not still other types of impairments or other types of challenges that individual faces, but I think it's important to remember that some symptoms are more stable and other symptoms do show change across the lifespan. And we know from a large body of research that continues to grow that individuals with autism, and particularly adults, have very high rates of other psychiatric conditions, so anxiety and depression, as well as health problems such as seizures, hypertension, and potentially Parkinson's and other health challenges. And adults with autism may need support in many areas that we don't think of as directly related to some of the other areas that we're assessing, but certainly difficulties in adaptive skills and difficulties with executive functioning. So these are the domains that are really starting to interfere with daily living. And so in terms of the diagnostic assessment process, I wanted to kind of walk through what that looks like for individuals who are coming to us later in life. And, but first I wanted to highlight that assessment really goes beyond an ASD diagnosis, or at least I think it should. So a comprehensive assessment should really help to understand an individual's strengths and challenges. They should be able to identify comorbid mental health or psychiatric disorders, and also should inform treatment planning. The first sort of essential component to any diagnostic assessment or comprehensive assessment should be, why is the person there? So when you're coming to a clinic, or you're bringing a family member to a clinic, what is it that you hope to gain from this process? And that should really guide the assessment. And if you're looking for diagnostic clarification, so if your primary question is, do I have an autism spectrum disorder, you should think carefully about what prompted the question of autism, and what sort of prompted you to come to ask or clarify the diagnosis right now, as opposed to 5 years ago, or as opposed to 20 years ago? And do you actually want to know? So you, the individual who's coming for the assessment, or is there someone else in your family that is really advocating for this clarification? And these are important because these are questions that clinicians will ask, and again should influence and guide the assessment process. And also, I think being ready and prepared to talk about what are the other areas that you may be seeking help for. So are there other mental health challenges that you're currently struggling with? Are there relationships that you're looking for support in navigating? So the second component of a diagnostic assessment should be some form of direct testing. So the first question should be your perspectives of your own strengths, and what are the areas that you think you struggle with the most. There should be some sort of direct interaction to observe social and communication skills, so a direct interaction with the examiner or the clinician that you're seeing. Often this is done in a semi-structured context, something like the Autism Diagnostic Observation Schedule, but there are other tools. But you should certainly be looking for, some evidence that the clinician is directly assessing these things. And it's really important to try to be honest and disclose your discomforts. We understand that the assessment process is uncomfortable for anyone going in, regardless of whether you're coming for an autism diagnosis or you're feeling depressed or some other challenge. And none of us likes to feel like we are being sort of analyzed, right? But the purpose to trying to do these sorts of observations is to really understand whether autism is, a appropriate diagnosis, and so these things have to be assessed and best done sort of in a direct interaction. And then often most comprehensive assessments will include other types of testing, so cognitive, language, adaptive functioning, and some sort of psychiatric interview if there's, particularly if there's evidence of other mental health challenges. The diagnostic interview process will include many questions about both current functioning as well as history, because the diagnostic criteria for autism spectrum disorder require that symptoms be present in the early developmental period. We have to ask questions. There has to be some evidence of challenges earlier in life. They may not be formally documented in the form of an early evaluation, but certainly you can come and talk about whether you've had social struggles or whether you've had, other kinds of relationship or emotional challenges throughout life. And we try to also get a sense for very, very early development in terms of just sort of developmental milestones and what other concerns may have been present for caregivers or other adults in your life earlier on. And finally, I think there's an important component to the diagnostic assessment process, which is we often ask for other people's perspectives. And many adults are hesitant in this domain because they're really feeling like for some adults who are living independently, that they don't necessarily want their caregivers to be a part of the process. And that's completely understandable. But again, I think it's really important to underscore that we don't know always what our individual strengths and difficulties are. And sometimes sometimes it helps to have other people's perspectives. So this isn't about trusting what an individual has to tell about themselves, but that we would like to have other people's sort of vantage points or viewpoints to explain what are the challenges and what are the strengths that they observe in the person that's being assessed. So most often this is a parent or a caregiver who can also provide some historical context, but certainly any other sort of informant that an adult is willing to give consent for us to talk about can be useful. So it might be a close friend, it might be an aunt or an uncle, it might be a sibling or a long-term partner or something of that nature. And so I think that's sort of the overview of the diagnostic process, but I think there are a lot of things for individuals who maybe don't yet have a diagnosis to consider if they're thinking about seeking a diagnosis. And so it's important, I think, to look for, when you're trying to find somewhere to go, to really think about what is the expertise of the person or the professional that you are approaching. So do they have experience working with adults with autism or other neurodevelopmental disorders? Do they have training in assessment and diagnosis? Would they provide a multimodal assessment? So would they have some direct observation? Would they be asking you questions about yourself? Would they be asking other people to provide their perspectives? And are they willing to focus on your questions and needs? They shouldn't be giving you a checklist that says, fill out 15 questions that say yes or no, and depending on that score, I will tell you whether you have autism. Because you could get that online, and I would caution a little against that. I'll talk about that in a minute, but certainly, this should be time with a professional who is really sitting down and listening to the challenges and the reasons that you're there and trying to help you better understand those challenges in the context of a diagnosis. And then the final thing I think to consider, and this is a personal decision, but is there support beyond a diagnosis? So are you going to a place that, once you receive a diagnosis, whether it be autism or otherwise, are they going to be able to provide some kind of support or interventions? And so this would, necessarily usually entail that they do assessments beyond the social communication repetitive behaviors, so assessing other areas that you may need support in. And often you might look for a multidisciplinary team, so that the clinician that you're seeing isn't the only person who could provide services depending on your needs, but certainly other professions depending on what your individual requirements might be. What to expect? I think it's really important for adults who may be listening or in the audience to understand that right now the majority of autism clinics are in pediatric settings, and we are taking a pretty child-focused approach to diagnostic assessment. And this isn't because we don't value your individual perspectives. This is because that's where the majority of the research has been, and that we know the most about children with autism, and we're really trying to expand that in our field right now and understand more about adults with autism. But we're still very reliant on caregiver report of history because we haven't yet developed the tools to really understand the best ways to ask those questions of an individual. And so, and also I think there is increasing awareness that there is more need for supports for adults with autism spectrum disorders and other neurodevelopmental disorders. And what that means is that right now it's still very much thought of as a childhood disorder, and therefore the majority of autism clinics are in the Department of Pediatrics, the Department of Child and Adolescent Psychiatry, and you shouldn't be put off by those sort of labels if a program is saying that they offer lifespan services or services for adults. I think the other thing to expect, unfortunately, is there are not a lot of programs that provide adult services, particularly in adult diagnostic services, and therefore you're often going to be told that there's a long wait list for a comprehensive assessment. And, I think, again, I would encourage people, if they think that this is a path that can be helpful to identifying better, the supports that they need or better understanding themselves, don't be put off by the wait list. Add your name on, and also ask whether there are more immediate services that can be accessed in order to support your individual needs right now. But certainly it doesn't hurt to get on a wait list. I understand it's frustrating because by the time you've decided to pursue this process, you may be sort of ready to go and not want to wait 6 months or a year. But I think unfortunately that's sort of where we're at. And certainly, I think most clinics will give you the long version of the wait list, i.e. tell you that it's going to be, up to a year. But the hope is that we're able to bring people in much sooner. We just don't want to promise that we'll see you within 3 months and then end up being 6 months down the line. Other barriers, I think, again, unfortunately, you should expect that some places you call will not be able to provide services to adults because they're limited by their departments or other infrastructure to only provide services for individuals of a certain age. And so you should be prepared to ask where might you be able to get supports. Some places are not able to take all types of insurance and various different payers. And I think one barrier that we don't often recognize, but can be a barrier for some people, is that we ask all patients to fill out a lot of paperwork. And more, I think, understanding that can be really hard on an individual level. It can be hard for families. And so if that's something that you feel is going to impede your ability to access the services that you need, you should let the person you're talking with on the phone, usually the clinic coordinator, know that and see what kinds of supports might be available to help us get the information we need in order to proceed with the process. So a few pros and cons of an autism diagnosis. I think certainly some individuals feel that there is a lot of validation in the experience of going through the assessment process and finding out that they have autism. It can help put their difficulties in context, a sort of better understanding of themselves and sometimes for other people, for example, partners that they're in relationships with. It may offer an expanded social network. So many individuals have sought out various blogs and online communities as well as in-person social networks. And we hope that the assessment and diagnosis will inform treatment and supports and various services that one might pursue. But I think the flip side is that, getting a diagnosis can be it can be sometimes a frustrating or a worrisome process. It can create anxieties about what does a diagnosis mean. In some cases, unfortunately, it results in stigma or discrimination when telling someone that maybe you have an autism diagnosis, particularly in cases where they don't necessarily understand or know what autism is, or maybe have a stereotyped, misguided view of what autism might look like in an adult. Certainly, individual experiences do not always match everyone else's with autism, and so sometimes it's disappointing to learn that, you have this sort of diagnosis, but it doesn't necessarily match what everyone else is describing. And so while you're looking for a community, sometimes some individuals find that that's not they have a harder time finding the appropriate subset of individuals that they can really connect with. And then certainly I think there is a lack of services, and that's not necessarily a con of getting a diagnosis, but certainly important to understand that a diagnosis isn't a panacea. It's not going to provide an answer that's going to just sort of magically change life or make everything easier. And we don't necessarily have all the services and supports in line to be able to promote everyone's well-being in the way that we wish that we could. But I think also remembering that a diagnosis doesn't define you as an individual. You are the same person before and after. You were told that autism describes the kinds of strengths and challenges that you're presenting with, and you really have to decide what to do with that information. So deciding both, what that means to you and how you integrate that into who you are, as well as, what people in your life you decide to disclose that to. And I think I want to highlight that, the diagnostic assessment process that I am sort of outlined today is really setting the bar high, and I would encourage every individual to expect the most and seek a comprehensive assessment. Certainly there are websites, again, I think I mentioned, that offer checklists that will claim to tell you whether or not you have autism, but I will tell you that no checklist, no measure, no interview is perfect. So even the ones that highly trained clinicians are using in these comprehensive evaluations, a single number on a single instrument based on a single interaction does not 100% tell us whether you have autism or whether you do not. And so certainly an online checklist is not able to always accurately make that distinction. And so, I want to advocate for the most comprehensive and best care possible, because again, I think this goes beyond deciding whether someone has autism, but also trying to understand on an individual level what we can do to provide supports. But also on an individual level, you have to decide for yourself where you're at right now and to what extent you want to seek out more comprehensive services, and to what extent you're invested in sort of having this question answered. And then the last thing that I wanted to just highlight is that everyone has strengths and difficulties. And so often when I talk about diagnosis, I'll have individuals who are feeling a bit offended or feeling a bit wary of a diagnosis and talking about, the sort of what a clinician may call a symptom, and highlighting that those are really the areas that make them unique or diverse. And I don't argue with that. I think when I'm talking about diagnosis, when I'm encouraging people to pursue an assessment, it is when those symptoms or those individual behaviors are resulting in the impairment that we were talking about earlier. When it's at a point when it's interfering with your day-to-day life in some way, then I think those are things that warrant a diagnosis, or at least coming to a clinic and questioning that. And what is impairing differs across different individuals, and sometimes environments are able to be adapted to support an individual to the extent that those behaviors do not necessarily interfere with life, and that's fine. But we're looking to see individuals in order to provide interventions or treatments that would help to support their day-to-day lives. We're not trying to change who anyone is. Again, diagnosis doesn't define who you are, nor does the treatment try to change who you are. We're trying to increase adaptability, both on an individual level as well as informing how the environment or the surroundings might be adapted. And it's really those the combination of those individual behaviors and that adaptability that results in individuals' strengths and being able to contribute on a larger level.
Dr. Ball, I do have just one other question.
Sure.
Which relates to this part of what you're going over, and that is the concept of improvement. The words developmental delay, which are used in part because it's considered politically correct, may imply improvement. Now, you've said that in development through childhood, there is going to be, for most people at least, some improvement. But at some point, whether it's in later childhood or in adulthood, and I'm talking after the assessment or at the time of assessment, and with whatever treatment plan is used, to what extent should people expect, or on the other hand, be disillusioned due to a lack of improvements? It's just very unclear to me if, let's say, there is a support framework, including psychotherapists and also counselors or independent living trainers, skilled trainers, and other people, and is there any guidance in terms of rough estimates for no further improvements in helping this population decide with a long waiting list of what difference is it going to make?
Sure.
Any comments on that?
I can try. That's like a whole another 20-minute to an hour discussion, I think. But
Oh, well, maybe
but just a quick comment. I do think that there's room for improvement across the lifespan, and I think we're selling ourselves short, and the individuals that we work with on the autism spectrum, we're selling them short if we assume that we can't make gains. I do think it's important to consider what kinds of interventions you're focusing on, and what are the gains you might expect. And so anytime you enroll in a treatment program, sort of akin to treatment research, there should be a clear goal, and there should be a clear way in which you're measuring that goal. And there should be some agreement as to how frequently you're assessing your progress toward that goal. So, for example, though, I think understanding that someone has autism and depression is a very treatable mental health condition. And so, but understanding that someone has autism and depression can help guide how we go about targeting the depressive symptoms. And we may expect progress at a different sort of pace. We may expect they need additional supports in our sort of standard, cognitive behavioral or whatever interventions you're using to target depression. So understanding that they have autism and their individual profiles helps us to better target the depressive symptoms.
But one should be optimistic, at least to the extent to see if goals are being met, whatever treatment modality is being used in a treatment plan before writing it off, so to speak, and moving on to...
Absolutely. And I think also for adults, it's particularly important that you carefully think about what are the areas that you really want to or need to make improvements. And so, there's a lot of focus in early childhood and interventions that maybe promote very specific social skills, or, how to approach a group of children in a school setting. And it's not clear always that those are the priorities for many of our adults who are coming in. And so thinking carefully, just what are what's the focus of the intervention that you're pursuing, and what's the end goal from that specific treatment.
Thank you.
And so that sort of segues, this is, I think, just about my last slide, but, talking about adaptability and intervention. So these are some different examples of jobs, and the second column shows different symptoms that may be characteristic of autism. So for example, I might be a sous chef. I might have a particular insistence that item arrangement on the plates is very precise. And so it may result in an impairment if I'm not able to move beyond that precision, and therefore, all of the plates that I am sending out in the restaurant take a very long time if they ever make it out of the kitchen. On the other hand, with the appropriate supports and increasing my ability to be adaptable, but also potentially adapting the environment around me, it may be that I'm able to really develop that skill into ensuring that my plating is perfect, and then every plate that leaves the kitchen is beautiful and presented how the master chef or whoever wants it to be. But again, so a way in which that sort of symptom could result in impairment, but with the right kinds of supports could also really turn into a strength and make me a very unique and well-fitted contributor in that particular job. So just a couple of examples. Whoops. And so, I think finally, again, this is a really individual decision, and this talk isn't meant to necessarily address the specific questions or needs of any one person. But I think, if you're considering pursuing a diagnostic assessment and wondering if you have autism, talk to people who know you well and whom you trust in order to, decide whether this is good timing for you. At UCSF, the program that I'm affiliated with along with Dr. Hendren is called the STAR Center. We do have adult services. There are also, Autism Speaks has a nice resource guide, and you can go in and search based on your zip code and get a sense for what other service providers are in your area depending on where you are. And so I just want to end by acknowledging, we have a really amazing clinical team over at UCSF, and I also have a great research team who, make all of my work possible. And certainly if there are any questions, if you're interested in clinical services, you can write directly or call directly to the STAR Center. And then if you're interested in research opportunities, feel free to contact my lab manager.